to order. Bobby, would you call the roll, please?
Joanne Murphy Spice.
Here.
Heidi Basford Kirkhoff is excused. Julie Kiefer's absent. Julie Davids is excused. Bryn Seaman.
Here.
Patricia Yurovitz.
Here.
Julie Maslowski is excused. Judy Ritchie.
Here.
Mike Ford.
Here.
Cynthia Thorpe.
Here.
Allie Ford.
Here.
Jean Wallerman.
Here.
Okay. Moving on, approval of the April 4th minutes. Does anyone have any additions or corrections? Bobby, I would ask you to, we missed it earlier, ask you to strike on page 2, the, from "and" decreasing through ad hoc groups, just strike that particular phrase, and everything else looked fine.
Move to accept the minutes.
I'll second.
All those in favor?
Aye.
Aye.
Opposed? Okay, minutes approved. Citizen statements, do we have anyone?
None.
Public comments
Didn't get any.
and proclamation.
Yes. So I shall read this, right? All right, get ready for this. Now, I'm going to refer to myself as Mayor Matt Mugerauer in this, just so you know. I'm not Mayor Matt Mugerauer. Whereas Oshkosh includes countless older Americans who enrich and strengthen our community, and whereas Oshkosh is committed to engaging and supporting older adults, their families, and caregivers, and whereas we acknowledge the importance of taking part in activities that promote physical, mental, and emotional well-being, no matter your age, and whereas Oshkosh can enrich the lives of individuals of every age by promoting home and community-based services that support independent living, involving older adults in community planning, events, and other activities, and providing opportunities for older adults to work, volunteer, learn, lead, and mentor. Whereas our community can provide opportunities to allow older citizens to continue to flourish by emphasizing the importance of elders and their leadership by publicly recognizing their continued achievements, presenting opportunities for older Americans to share their wisdom, experience, and skills, and recognizing older adults as a valuable asset in strengthening American communities. Now therefore, here we go, I, Matt Mugerauer, Mayor of the City of Oshkosh, do hereby proclaim the month of May 2023 as Older Americans Month in the City of Oshkosh, and urge every citizen to take time this month to recognize older adults and support them as powerful and vital citizens who greatly contribute to the community.
Thank you, Mike.
Thanks, Mike.
Fortunately or unfortunately for the mayor, there were multiple requests for proclamations. And so it was convenient to have the proclamation brought to our meeting, and it still gets televised and everything. So thank you, Mike.
Yeah, you're welcome. I'll mention it on May 9th too, whether they want me to or not.
Okay, moving on. We're having a speaker that we've sort of anticipated off and on for a couple of years, but never got actually on the calendar. We have Ingrid Kundinger with Senior Medicare Patrol on preventing Medicare fraud. Welcome, Ingrid.
Thank you. Thanks so much for having me. Is this working the way it's supposed to and all that fun stuff?
Andy will let you know if it isn't.
Okay, perfect. I got the thumbs up, so that's a good sign. As Judy mentioned, my name is Ingrid Kundinger, and I am here from the Senior Medicare Patrol program, and just going to spend a little bit of time this morning telling you a little bit about Medicare fraud in case you're not aware of that, and then also letting you know that this program is a great resource for you if you're working with older adults and Medicare beneficiaries, as well as a resource for Medicare beneficiaries. So hopefully when we're finished, you'll have a better understanding of who we are, what we can do, and how you can connect with us if you should find that interesting. So if you have questions or comments throughout, just let me know. I'm happy to stop and answer those, and I can stick around afterwards as well if you have other questions or want to talk more about that. So, like I said, today we're going to talk about the Senior Medicare Patrol. We're going to talk a little bit about Medicare fraud in Wisconsin, give you a little snapshot of what that looks like or what we're hearing from Medicare beneficiaries across the state. share a little bit of information about what folks can do to protect, detect, and report Medicare-related fraud, abuse, and errors. And then I'll share some of our available resources with you as well and let you know how you can get those if you're interested. So really quickly, what is Senior Medicare Patrol, or SMP? We are a federally funded program through the Administration for Community Living. There are Senior Medicare Patrol programs in all 50 states as well as the 4 U.S. territories. Here in Wisconsin, the program is housed at GWAR, the Greater Wisconsin Agency on Aging Resources. It was great to meet one of my colleagues in person today, Bryn. We have done a lot of virtual meetings, but not ever met in person, so thank you for that opportunity as well. And the program is volunteer focused, and it was intended to be that way since its inception in the mid-1990s. Congress dedicated funding for this program across the country with the expectation that it would be volunteer driven, meaning boots on the ground in communities all across the country, providing this important educational message to Medicare beneficiaries about ultimately how they can protect themselves from Medicare related fraud. And then lastly, all of our resources and materials are available at no cost, and all of the information and communications that we have with Medicare beneficiaries is confidential. So here you can see the Senior Medicare Patrol mission, and I'll just read that so you have a better understanding overall of who we are and what we do, and then I'll talk more specifically about each of those parts, is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So this gives you an idea of what mission delivery looks like for the Senior Medicare Patrol program. We staff booths at community events, health fairs, senior expos, that sort of thing, allowing us the opportunity to share our resources and interact with folks one-on-one as they stop to learn more about us. We also give presentations, obviously that's what we're doing here today, both to professionals who work with Medicare beneficiaries as well as to Medicare beneficiaries themselves and their caregivers and advocates. So basically anyone who's interested in hearing more about us, we'd love that opportunity to share that information. And then lastly, we do also operate a toll-free helpline where folks can call if they have concerns or they, just got a phone call and maybe shared information or maybe didn't, but just wanted to tell someone about the phone call that they received, or maybe they received some durable medical equipment. We'll talk a little bit about that in a minute, that arrived on their doorstep that they have no idea where it came from, how it got there, who's paying for it, but they don't want it, and how are they going to be able to send that back, that sort of thing. So we also make connections to other resources if they've reached us by mistake or need additional services. We're obviously well connected within the aging network in the state of Wisconsin to make sure that those important connections are made for them. So maybe you probably aren't wondering this because you're all working with older adults in some capacity, but oftentimes people think, well, why is this even necessary? Why does the Senior Medicare Patrol program even exist? And unfortunately, the Medicare fraud, errors, and abuse estimate is in the billions on an annual basis. And you probably just had breakfast, maybe you didn't. This is always a little unsettling information, but the estimate currently is between $60 and $100 billion on an annual basis is either in fraud, abuse, or errors. And that's just for the Medicare program. So I see a lot of people like, wait a minute, that seems crazy. It is crazy. I can't even fathom the amount of money that is. And, we're all healthcare consumers in one way or shape or form, and the costs continually rise, and co-pays are always increasing, and deductibles, et cetera, et cetera. And one of the reasons is because there's as much fraud, abuse, and errors as there are in that system. So that is why the Senior Medicare Patrol is here. We obviously are only able to do a small part in that, but we're really focused on getting out ahead of these things, educating as many people as possible about how they might protect themselves so that they don't have to deal with this issue at all. And then we also are able to, if something's already happened to someone, we can kind of intervene. I'm not an investigator, but we are more information collectors. So we'll gather information, we'll talk to the beneficiary or the family member, get as much information as possible, collect related documents if they're receiving statements, if they have their Medicare statements, photos of things they've received, actual items that they've received. We'll gather all of that information, and then we provide that information back to the federal level, to the Office of Inspector General, and that is where the investigations take place. So it's important, we really stress to people that it's important that they report things, even if it's, $5 or $10 or $100 here, and they think maybe it's not a big deal. It all adds up, obviously, to $60 to $100 billion. So every one of those reports does matter. So when I started this program, thought, okay, 60 billion, that seems like a lot. That's probably not accurate. And then I also thought, kind of like Pollyanna, I guess, oh, it doesn't happen in Wisconsin. Everyone's nice in Wisconsin, and no one would want to take advantage of folks in Wisconsin, and very quickly learned, unfortunately, that is not the case. So I just wanted to share a couple of the top or the most reported concerns that we hear from Medicare beneficiaries via our toll-free helpline, or while we're out and about in the community at presentations or at tabling events, what people are telling us about. So the top three, as you can see here, are new Medicare card scam calls, durable medical equipment scams, and then genetic testing scams. So I'm just going to tell you a little bit more about each of those. Maybe some of you, they will sound familiar as I'm talking more about them. Maybe it's brand new to you, but hopefully you'll have a better understanding of that. So the first one is new Medicare card scam calls. So there's a fraud alert in your packet that talks more specifically about this, but basically there's a lot of different fraud happening where the fraudsters will call and ask a Medicare beneficiary if they received their new Medicare card. Well, that's kind of a red flag to folks thinking like, no, I didn't know I was supposed to get one. Or they say, do you have a red, white, and blue Medicare card? If people are Medicare beneficiaries, they would answer that question as a yes. And then the fraudster will go on to say, did you know that that red, white, and blue card is going to expire? Or did you know that the red, white, and blue card is no longer valid? The new card colors are orange, green, and yellow. Or did you know that you now need to have a plastic Medicare card? Or did you know your Medicare card needed to be laminated? Or you can see where this is going, or all sorts of things. And so if people aren't connected or don't realize that none of these things are in fact true, they're a little bit nervous, because oftentimes the fraudster on the phone is also going to perhaps be a little bit threatening and say, most people will initially think like, wait a minute, someone told me once I should never share this information over the phone, so I shouldn't talk to you. But they're good at what they do, $60 to $100 billion, so they can be very convincing. And so at some points they're telling people that if they don't share information, they'll let their healthcare providers know that they're not compliant. That's really not a thing, but sometimes people don't know that. And they will also threaten to put a stop or a hold on a person's Medicare benefits until they comply with whatever they're being asked for. And again, people are going to be fearful of that. They need to be able to rely on their Medicare benefits to be available to them at any time. And so we are just letting people know that that's not true. The red, white, and blue paper, pretty generic card that people get from Medicare, that's it. There's nothing fancy about it. There's not a chip card in it. It's not plastic. It doesn't need to be laminated. It's just that simple card. And so we're just trying to let people know that. And I was in Sheboygan yesterday at a presentation, and it was a smaller group, and one, they were kind of like, oh, I've never heard of that. And then one lady left the presentation, went to talk to a friend that was playing ping pong or something somewhere else in the senior center. She came racing back in, and she's like, my friend got that call. I'd never heard of this before. So it's happening, unfortunately. And what happens is that they're looking for Medicare information. So once they're talking and someone says, no, I didn't know that I needed a new Medicare card. Great, I'm so glad I called you today. I can help you with that. All I need to do is verify your Medicare information, and I'll get that new whatever the card was sent to you. So then a person is sharing their Medicare information, and from there, kind of the sky's the limit for the fraudsters as far as what they're going to do with that. Most often what they do with that is to, once they have a Medicare number, then suddenly the person is talking to a different person at this probably call center, more than likely overseas perhaps even. They're talking to them about some sort of brace. So that's where the next thing comes, because they need to be able to have something that they can submit a claim to Medicare for with that Medicare information. So that's where the durable medical scams come into place. Sometimes the phone call is directly, hey, do you have back pain? Did you know that Medicare would cover a free back brace for you? I'd love to send that to you. All I need to do is verify your information and I'll get that sent to you. So here's the thing with that. Medicare does cover durable medical equipment. Medicare only covers that equipment when it's ordered by your healthcare provider. So there needs to be a prescription or an order written for that. And then that order goes to a durable medical supply company that is approved by Medicare to provide that equipment, and it's all good. So I don't want the message here to be that that sort of equipment is bad and it shouldn't be used. It 100% can be very helpful for lots and lots of people. So that's not the issue. The issue is when someone calls you out of the blue asking you for that sort of information. That's, they're going behind the scenes, they're submitting claims to Medicare, sometimes unbeknownst to you, and your doctor has nothing to do with that. And so what happens then is if Medicare paid for a back brace for me today, even though it wasn't ordered by my doctor and it maybe didn't even arrive at my home, because sometimes people don't even get this equipment. Medicare gets the bill, the beneficiary may or may not even receive the equipment. Let's say 3 months from now, I hurt my back and I really need that back brace. I go to my healthcare provider, he or she writes me an order for that. All the processes are followed the way they should be. When it gets to Medicare, Medicare is going to reject that claim and say, nope, we just paid for that for you 3 months ago at a time when I didn't need it. So then I'm going to be in a situation where I will either have to pay for that out of pocket or I'll go without. And unfortunately, some older adults find themselves in that situation. If if they don't have a lot of expendable income, suddenly if were fallen victim to a piece of that and didn't even realize it, it doesn't come into play until they're left with a bill for hundreds of dollars for something that they weren't expecting. So that can, turn into an issue of patient harm. So our message about this is that we really encourage people to, if someone calls them out of the blue and is asking them about back pain or any sort of pain, to just hang up the phone. Because, why would we talk to people about random people that we don't even know about that sort of thing? They use buzzwords like it's free, all those things, and people like free things. We all like that. But, if you stop and think about it, it's not free. Someone's paying for it somewhere along the way. So that is not necessarily the case. So we just really encourage people to work directly with their healthcare provider for that, to not fall victim to a phone call. Sometimes people will see the television commercials for different sorts of back braces, knee braces, ankle, all the braces, and think, oh, well, I'll try it. It's free. I'm going to call this 800 number. We heard from a gentleman in southwestern Wisconsin who was suffering from some back pain, and he was having trouble sleeping. And so he was up late at night watching TV because he couldn't sleep because his back hurt. And he kept seeing this commercial on TV every night about this back brace that was going to be the greatest thing on the planet and everyone should have it and it's free and Medicare is going to cover the cost. And so one night he called and he ordered the brace. He thought, well, I'm going to try it. What's it going to hurt? It's not going to cost me anything out of pocket. They tell me Medicare is going to pay for it. So he called. Well, here's what happened to him. He got 7 boxes of things from all the braces for all the body parts, extra small to 4. They didn't really care about that. And he was really frustrated, but he packaged them all up, sent them all back, didn't say anything about it. He called us when he got his Medicare summary notice, which is his quarterly statement that provides an overview of all the claims that were submitted with his Medicare information during that 3-month period. And it was over $30,000 worth of things that Medicare had paid for in that 7 boxes of stuff. And he was very upset with himself. He was very upset with the whole that could even happen, and he wanted to know what he could do to stop that. So in that situation, as I said earlier, I worked with him. I got copies of all of the things that he had. He had receipts and documentation that he'd sent it all back, and we submitted that all off for investigation. And they did prosecute on that case, and there's people in jail and not practicing medicine and that sort of thing as a result of that. So it's all is not lost. Oftentimes, from a caregiver's perspective, we'll hear from an adult child who's maybe not around all the time, but they're home for the holidays, or it's mom's birthday, or it's Father's Day, or whatever the case may be, and open the front closet, and it's full of boxes of durable medical equipment, and they're wondering, how did this happen? Where did they get this? How do we get rid of it? Did someone pay for it? Do we need to do something about that? So we just want to let people know that we're there to help them in that sort of a situation. And then lastly, another thing that we hear often about is genetic testing scams. So again, these are typically done over the phone, where the caller is asking an individual if they have a history of cancer in their family, or if maybe they have cardiac issues. Unfortunately, most of us would probably answer yes to one or both of those questions. And then they're offering that they will send a genetic testing kit to the person's home. All they need to do is a quick cheek swab, put the thing back in the tube, and then send it back. They'll send results to the doctor. It'll be all well and good. And so a lot of people think, oh, this is going to be simple. I don't have to leave my home. Everything's going to be sent to me. The catch here is that Medicare is very, very specific about what they cover and don't cover as it relates to genetic testing. Most often they don't cover that. I mean, there's some very specific diagnoses that need to be documented in a person's medical record in order for them to pay for that. So in these cases, sometimes people have been stuck with bills they weren't expecting as well for denied claims from Medicare for these genetic testing kits. So again, we're encouraging people that if there is a test or they are concerned about anything related to this, that they should work directly with their healthcare provider. And again, not the random person who calls them on a Tuesday afternoon at 4:30 when they're starting to think about what they're going to have for dinner, and then is suddenly very persistent on the phone about providing that. So that's kind of a snapshot of what we hear most about. Are any of those things like surprising to you? Did you think something else might be on that list, or it seems about what you were expecting? Any thoughts about that? No? Yes.
This sounds like a very naive question, but what's the benefit of the fraudster on the other end if they're actually supplying the durable medical equipment? So how is the benefit? Because they're actually facilitating the delivery of the equipment, even if it's unnecessary.
Sure. They are getting paid for it. So they get reimbursed from Medicare. So if I get a brace and I didn't need it, but they submitted the claim to Medicare, Medicare doesn't know that I didn't need it because
Even though it's not a physician who ordered
well,
it.
oftentimes they have physicians who are working on a kickback scheme. So here's an example. So someone gets a call, they share their Medicare information, and maybe it's happening, who knows, maybe the call center's in California. So they're just robo-calling all these people. They're just hoping that someone's going to answer the phone and they can talk to them long enough to convince them that they're legitimate and that they're truly going to provide them with whatever service. They get their Medicare information, so they're like, that's success number one. We have a number. Now they're going to transfer to someone to talk about whatever it is they're going to bill them for. Let's say a back brace. Perfect. So we're missing, like you just said, we don't have a doctor's order. So we've got doctors that are willing to act unethically and write orders for these things for a kickback. We had one physician in Edgerton, Wisconsin, which is near Janesville. He was involved in a kickback scheme. He submitted in a 4-year period over $26 million in fraudulent claims to Medicare for durable medical equipment, of which Medicare paid over $13 million of those claims. It finally caught up with him, and the judge asked him, like, what was in it for you? Like, why did you think this was a good idea? He was getting $30 for every order that he wrote that got submitted to Medicare and was made, then, and a claim was made on that, $30. So ultimately, not that $30 isn't a lot of money, but ultimately, he put his medical license, basically his life, on the line for a $30 kickback. And he's in jail. He won't be a doctor. He's going to have to figure out restitution. Like, his life is kind of over as a result of that. Does that answer your question?
It does, thank you. I was missing the piece of how
Sure.
they actually got the medical claim to them and were actually able to keep that money upon delivery of the item.
Yep. So oftentimes people will call and say, I just got my Medicare summary notice, and like, I don't know who this doctor is. I've never seen that doctor. So sometimes it could be, if you've had surgery, it could be an anesthesiologist or someone that you didn't see or don't remember seeing in that whole process of like what happens before surgery. In other cases, it's been that because of a specific test that was maybe ordered, the healthcare facility that you go to doesn't process that in-house, so they send it elsewhere. But oftentimes it's because that's someone that's never seen you and they're hoping that you didn't look at your statement and raise a red flag about that. Yes, ma'am.
I would like to add to your comment, if you ever order any equipment, the markup is incredible. So that's the other incentive, is that they can send you something and it may have cost from that cost, $30, and they may be charging $2,000.
Okay.
There's
Yes.
a large gap. They can pay off the doctor who
Yep.
writes the script, and they're still rolling in the dough.
Okay.
Think of in the hospital,
It's,
that it costs for an aspirin, and they may charge $25-$30 every time you have an aspirin.
Yep.
Markup.
and a lot of these durable medical equipment companies that are kind of not acting the way they should be, they don't even, there's warehouses down dirt roads. Like, people will share the address from their statements, and I jump on Google to find it, and it's literally like in North Carolina, in some city down some dirt road, just a big warehouse. And to your comment about markup, I think some of the things that these not so ethical companies do too, the stuff they're sending people is not quality.
Right, it's junk to be.
It is much higher quality. Regardless of what the cost of it is, sometimes, I've seen some of the things, like, you'd probably do more harm than good by even attempting to use some of that equipment. So it's just an issue, unfortunately. Any other thoughts or comments?
I have a
Yes.
question that's, I don't know if it's in this realm. It's not a scam, but I'm very suspicious of a service that is offered out there. The people, as they come on Medicare, you have to, you get basic, and then you have to choose a secondary insurance. And there's a lot of people have gone in the business of advising people which one of those to choose. How does the applicant applying know that that person is truly in their best interest? Who are they working for? Because, there's so much to read. It's a lot of people I know just want to hand it to somebody. You decide for me what's in my best interest.
That's a great comment or question, and that is an issue. And, Medicare is very complicated. They certainly do not make that user-friendly for someone who's either new to Medicare or maybe has been on Medicare and realizing that the coverage that they have isn't maybe what's best for them. And there's a lot of advertising that goes on, especially around the open enrollment period in mid-October to early December. Hey, does your plan offer you free this and rides to this and extra money here? People are, wait a minute, why doesn't my plan have that? And I don't have a great answer for you in terms of, like, how do you know if your insurance agent or the person that you've chosen to work with truly does have your best interest at mind? Because it's a business, and there, for an insurance company, there is a commission on the line for having someone sign up for this plan, or maybe this plan's even a little bit more commission. So what about this plan? When people ask us about that, we direct folks to their local aging and disability resource centers, because there are elder benefit specialists in all of the counties and tribal aging units, et cetera, across the state, who are benefits counselors. So they are able to sit down with folks and provide what we call unbiased information. So they're not paid by commission. They're paid through the county and however that in that community, however that's structured. But it doesn't matter to them if you pick Humana or Security Health or whatever the options are. They're going to schedule an appointment with you and take the time to listen to what's important to you, what your concerns are. They'll probably ask you to share the medications that you're currently taking so that they can work with the Medicare Plan Finder to see, at least for a prescription drug plan, what your options are within, how far do you want to drive to the pharmacy? 5 miles, 50 miles? Put that all together. But at the end of the day, it doesn't matter to them. They're not going to make a decision for that person. They're just going to provide them with information so that they can take that information back and ask family members, or maybe they have a trusted insurance agent that they've worked with before to say, here's what I was told, I'm interested in this. But it is misleading, and people get tangled up in that all the time, because they're thinking, well, wait, my neighbor has this plan, why don't I? Or they see Joe Namath on TV advertising whatever he's advertising, and unfortunately, some people, and that's why he does it, Joe Namath, he's this great ex-football player. He would never tell me something that's not true, and maybe it's not untrue, but it's misleading. And sometimes from those national commercials, they're national. So some of the fine print at the bottom that scrolls past the TV super fast and no one would read it anyway, maybe it's not even available here. And unfortunately, people don't know to ask those questions. And when they call those 800 numbers from the television, maybe they think they're calling Medicare, but they're calling an insurance broker. So that opens a whole nother door to them. They're going to be getting a ton more phone calls. It's going to be high pressure sales for them. And sometimes people just say, like, I just finally told them, yes, I'll do it, because they were so frustrated, not realizing what the implication was until now it's January 2nd. My new health care is in effect, and I went to my doctor, who I thought was still in network, and they're not. Or I went to the pharmacy to refill my prescriptions and found out that the medications that I'm taking aren't included on my new Part D prescription drug plan's formulary. So either I have a significantly higher payment that I need to make, or I'm going to have to pay completely out of pocket for it because it's not covered. So again, when that happens, we redirect folks back again to the Aging and Disability Resource Centers and the Elder Benefit Specialists. They're magic workers in so many ways, but they are able to help people get out of those plans and get back into the plan that they had previously. So that was a really long blah, blah, blah about your comment. So hopefully that was helpful. All right, so then when we're out and about talking to Medicare beneficiaries, our main messages are about what they can do to protect, detect, and report. So when we're talking about protect, it seems pretty simple, but we're really encouraging people to be careful on the phone. Primarily, these scams happen via phone. We do hear on occasion of email messages with links or text messages, sometimes mailers, but primarily it's on the phone. And sometimes it's just because people are so sick of them calling that they figure, fine, I'll just do it, and then they won't call me again. But unfortunately, that's usually not what happens either. So we're encouraging people to just really be careful. If you don't recognize the phone number, don't answer it. If it's a robocall and they're offering you options to press 1 to speak to a customer service representative, or press 9 to get your name off the list, like, yeah, that sounds great, right? Don't press 9. You'll probably get 9 million more calls than actually not getting any more calls. Just hanging up the phone and just being really cautious of that. Most of the time the fraudsters aren't leaving a voicemail message. They're going to just keep calling you. So we just encourage people to I know it's annoying to listen to a phone ring and ring and ring. There are some phone carriers or phone providers that offer different services for that. So we encourage people to reach out to their phone carrier to see if they have any blocking services that are either part of a package already or an additional fee. And we also encourage people to make sure that their landlines and cell phone numbers are listed on the National Do Not Call Registry. And while that's not 100% foolproof, it certainly does provide some coverage, or some of those calls aren't able to get through as a result of that. As far as detecting, we encourage people, and this is not even just Medicare beneficiaries, this is all of us as healthcare providers, to really pay attention to our statements. So either a Medicare summary notice for someone who has original Medicare, or an explanation of benefits statement that is going to be from a Medicare Advantage plan or from the Part D prescription drug plan, to really take a look at those when they come, either online or in the mail, and make sure that what's listed there is an accurate reflection of the health care that you received. The fraudsters hope we don't look at them, because then we're never going to say, wait a minute, I don't recognize that name, and they'll just keep at it. When everyone's looking at their statements and calling a timeout, so to speak, on some of those things, then perhaps we can slow some of the fraud for that. So we really encourage people to do that. And it can be a little intimidating. A lot of times people are like, oh yeah, I get that every month or every 3 months. I don't even open it. I opened it once and it was so confusing. I think it's important, but I'm not sure why. I don't know what to do. I don't know where to look, so I just keep them. So, we offer that if folks want to give us a call when they get one, we can kind of talk through some of the key sections to look at so that they can, that it's going to tell you, make sure that it's really you and all of your information is accurate. But then where the providers are listed, make sure that that's a provider that is familiar to you. If not, that could be a red flag. So we offer to provide assistance with that. We also have My Healthcare Tracker. There's a sample copy of that in your packets, which is a small notebook sort of resource that we encourage people, if they don't already have a system, perhaps this could be something that they could use. It's meant to be something that you would take with you to a doctor's appointment, and then just not capture all of the details of that appointment, but maybe just write the date, the doctor that you saw, and did you have lab work? Did you have x-rays? Was it just a general visit? So that when you get your statements, and remember the statement might not come for another month or 2 or 3, when you get that, then you at least can compare and make sure that the dates and the providers and the services they match. So that's kind of a checkpoint. Some people use a notebook. Some people use MyChart on an app on their phone. So there's all sorts of different versions of that, but a lot of people, myself included, kind of like a paper, even though we're not supposed to like paper. I do like paper. And so sometimes that can be helpful for folks as well. And so that's a resource that we make available. If you work with a group of people that think that might be of interest to them, you can order them from our website and we'll ship those out to you at no cost. So that's one of our resources as well. And then the last thing is report. So we want people to, if something doesn't look right, we want people to tell someone. Call your provider if you got a statement and it doesn't make sense. If you don't get an answer that's suitable to you, you can call the Senior Medicare Patrol and we'll kind of work through next steps, what to look for, suggestions to kind of help steer you on that path. Sometimes people call, they've shared their Medicare number, they haven't been able to sleep, they're so upset. What do? How do they make sure that that's safe? And so we can, walk them through step by step. We can facilitate a 3-way call with Medicare directly if they're nervous about calling Medicare or they haven't done that before. If they have concerns about what questions they should ask their provider, we can kind of brainstorm some questions. In some cases, we've called the provider with the beneficiary just because they were concerned about that. So kind of empowering people to make some of those phone calls for themselves, but also helping them, because realizing that sometimes people don't want to call the governmental agency or they're nervous that they're not getting the right number or whatever it might be. So we can help facilitate those sorts of phone calls as well. As I said earlier, we're volunteer driven, so we are always looking to add to our volunteer team across the state. We have volunteer opportunities for people to help us staff tables at events and community health fairs. We have opportunities for people to give presentations. And then we also have an opportunity for folks to help with calls that come in to our toll-free helpline. So if you or someone you know might be interested in this opportunity, you can have them call our helpline and we'll get you in contact with our volunteer coordinator. We provide all of the training, all of the materials, all of the mentoring and the support for volunteers to be successful in their work with the Senior Medicare Patrol. And then lastly, some available resources that we provide. We have our website, smpwi.org, where there's some information there on different fraud trends and that sort of thing. All of our newsletters and fraud alerts are archived there. You can request a presentation or us to participate at a community event via our website, and you can also request materials. the My Healthcare Tracker, we already talked about that. There's a copy of the quarterly newsletter, The Scoop, in your packet. That's something that we send out, as I said, on a quarterly basis. We can send that out either as a paper copy or electronically for folks. I know Judy mentioned that she receives our newsletter on a regular basis, so that's great. If that's something that you would like to receive also, you can let me know, or you can shoot us an email or request to sign up for that newsletter on the website as well. And then go ahead.
I was gonna say, it's nice getting it electronically, because then I just keep saving them all in a file for Committee on Aging. And I use that as a resource when I'm talking with families sometimes.
Yep, that's fantastic. And also, if some of you at agencies or organizations where you work, if you also produce a newsletter, all of the information that is included in our quarterly newsletter is available for reprint. So if there's an article that you're interested in, or you think, oh, I want to have this, you can just either take it from there, or you can send me an email and I can send you the just that article, like in a Word document or whatever you're looking for your information. So we try to have a good mix of information specific to Medicare related fraud and scams, obviously, but then also other information that would be important or beneficial to a Medicare beneficiary. So there's always updates from the Social Security Administration, there's information from the Better Business Bureau, and then a number of other articles and things that might be of interest. And then lastly, we issue, as I said, fraud alerts from time to time if there's something new or something that we missed a deadline for the newsletter and now we want to get it out before the next newsletter comes. So we will issue those from time to time as well. And as I said, there's one of those in your packet specific to the Medicare card scams. And then here's how to contact us, and our information is on all of the materials as well. The toll-free helpline through our website. We are on Facebook, so we do have a lot of aging and disability resource centers and senior centers that follow us and share our information as well. And then our general email box is another way to reach us. So that is the information that I had prepared to talk to you about today. Does anyone have any questions or comments? And again, I'm happy to stick around if that's all right, and if you want to chat afterwards, that would be great too. But if there's an opportunity ever for a group that you're involved with to have someone come and speak, we would love that opportunity. And if there are any health fairs or community expos or things that you think we should know about, we'd love that opportunity as well. Thank you.
Thank you.
Yeah, you're welcome.
Okay, moving on. Heidi is not here. She normally covers scams. So instead of what I was going to tell later, I think I'll do right now. I'm sure on the news lately, you've been seeing a lot about the, down in Milwaukee, the attacking the postal carriers for the key that gets into the blue mailboxes, drop boxes, and the stealing of checks and washing them, for lack of a better term, and writing a different dollar amount in there, who they're paid to and everything, and then recently cashing them up in Green Bay. Taking like a $30 or a $50 check, and it suddenly becomes $2,000. So that's a big issue. And then one of the things that went along, actually too, in the city, a lot of times as you're going down the street, you'll see somebody with the clothespin on their mailbox with letters that they want outgoing because they can't leave the house or whatever. That's a very ripe opportunity also. Or those little mailboxes that are overflowing with the junk mail along with the regular mail. In the rural area with the mailboxes, especially if it's not a lot of people in the neighborhood, again, those are targets. And one of the things, Door County, one of the ones that have been talking about it, rather than using a regular ink pen, ballpoint pen, it's suggested to use the gel pens. And yes, they're messy, they smear, but they're also harder to remove the ink so that the check can be filled out again. So a couple of really quick tips there. Then we'll just go around the table with other business. Jean, you want to start with yours?
Yeah. First of all, I want to announce that we just received a $10,000 grant from AT&T to help with our tech education series. So we are going to have speakers come in often, I don't know how often yet, to talk more about technology and more education for everyone going forward with whatever is out there for tech. In the newsletter, page 27 is our Food Truck Fridays. So this is our largest fundraiser for our friends. June 9th and August 11th, you are all invited to South Park to come in and enjoy many food trucks. I believe there's probably around 15 of them. And then bands, entertainment, and just socializing. Hopefully it's a beautiful night. So it's Friday, June 9th and Friday, August 11th. The last thing, we are still taking individuals to come in to the center to get a free balance test. And that is also a grant that we received. You will go through a series of 4 tests, and then you will get a good rounded base of where you are at with your fall's study for yourself, and then you receive some night lights to help you with getting up at nighttime, and that is also included with your free test. So we still are taking individuals for those tests, so call the center anytime and get registered. So that's all I have.
Okay, Ally?
I just wanted to put a plug in for the drop boxes that Aurora has for unwanted medication to dispose of, and just a reminder for everybody to go through their medication cabinets, especially older folks. That stuff tends to pile up and can be a safety hazard for getting into the hands of others. So a safe place to drop them. Aurora has a drop box at the hospital on West Haven. And I know the public health department also has disposal kits as well to help you dispose of them and deactivate the medication before throwing it away.
Do you have to do anything with the packaging? Do you have to empty them all out?
No, nope, just put it all in there. Yep.
Hi, sorry, barely not talking enough. Health Department, we have got a new class starting at the Oshkosh Senior Center. It's pushed back a couple weeks. It's May 16th, and it's called Mind Over Matter. It is for women only, but it is a bladder and bowel incontinence class, which actually helps with falls prevention if you're not rushing to the bathroom all the time. There's just a plethora, I don't know other word to use, of information on the Public Health Department website for people. And if you are looking for any kind of services, we have a newsletter, we have a Facebook page. For our seniors, we'll come into your home as a nurse and help you with a Stay Active, Be Confident, which is a falls screening and prevention program. Will go into your home. There's just so many different programs, I can't list them all, but if you go to our website, they're all there, and you can always call the health department as well, but we just have a lot of information, a lot of resources. We've got nurses available, so I suggest, just take a look at it. Just be aware that when you go to the Winnebago County Health Department, you pick Wisconsin, because Rockford, Illinois is in Winnebago County in Illinois, so just be aware of that when you're going in there. And I know Tai Chi is coming this summer to the Oshkosh Senior Center, and that class is specifically, the Tai Chi is specific for arthritis and falls prevention. So the moves are based on those 2 goals. So again, if that's something that you're interested in, that will also be occurring at the Oshkosh Senior Center. I'm starting a new Strong Bodies weight strengthening class at Miravita Living. So we've got lots of new stuff going on. And if you're ever interested in a class at where you live or whatever, just let us know. We'll make it happen.
Me. So I guess in keeping with the proclamation, I thought that I would share information from ACL, or the Administration on Community Living. I once again only brought 6 copies. I apologize. I never know how many to bring, but I'll make sure that I send them to Bobby so they can be shared, but also part of the notes. Just providing ideas of how you can stay active, be more involved as an older adult, or if you aren't an older adult, how to support somebody throughout the month and honor them, understanding how much older adults bring to our day-to-day, to our workforce, and to volunteerism. Very much a valued part of our population and our communities. And then I know this is short notice. It's been in a few of the things that I've shared in the past. It's also been in our GWAR newsletter on Facebook. I'll just give one last plug for next Tuesday, May 9th. This will be my first Aging Advocacy Day in person. Over COVID, I had done them virtually. But this is an opportunity to go to the Capitol. You are given information from Janet Zander and others as to how to make plugs for your need in your community and different funding sources that are near and dear to your heart. And then there's even a time in the afternoon where you get to meet with your local policymakers. So representatives, assemblymen, or women, and senators. So if that is at all of interest to you, you are welcome to sign up. They're still taking people. The theme is to wear yellow next Tuesday. I'll let you know how that goes if you're interested. And there's about 4 main points that I'll just share that we've put together as far as advocacy efforts, which are supporting and fully funding the Aging and Disability Resource Centers. Based on when ADRCs were established since 1998, some of them receive different funding, and that means they can provide only a certain level of supports in their community. So making sure that all populations are served equitably. Of course, family caregiver grants, with now more and more family caregivers stepping up to provide those supports and sometimes even intense medical care in the home. And then those other Older Americans Act programs like our nutrition program, so our home delivered meals or our congregate sites, and then health promotions and transportation are up on the list of things that we want to share about. So busy day next Tuesday.
Sounds like it. Yeah, just we have a new council member. We filled the open seat last Tuesday. Lakeisha Hayes was selected. If you remember, she testified here or gave a presentation here 2 months ago or so. So yeah, if you see Lakeisha, congratulate her.
Awesome.
Judy, could I add one more thing? I'm sorry. I forgot to mention this. I'm sorry. Probably because I really don't want people to watch it. We are going to be the health department, the promoting healthy aging part of the health department. We'll be on the Eye on Oshkosh program on TV this Thursday. I believe it's at 6.
Pat?
Nothing to report.
Cynthia?
I would just like to add that Rock the Block is happening this month in Menominee South neighborhood, and there's still opportunities for some volunteers who have from no skills to very special skills to help out. There is a website that they can go to, Rock the Block, and sign up and hopefully help out a neighborhood have a facelift and look better in the
Thank you. Okay. I have 4 other things here. How many of you knew that there's going to be another area code for this region? And so if you start getting a 274, that is this general area, because they're running out of numbers for the 920. So they're not going to all be scam calls when they start coming through with that. No. This is actually Winnebago County Parks Department, but it's something that would be of interest to a lot of the city residents also. And they have a new program called BAGO, Be Active, Go Outside. And every month they've got a special activity. So April they had After Dark Egg Hunt. They've had the glow stick sort of a hike, snowshoeing through the park, all sorts of neat things. So something to look forward to. And then, any of you pay attention to iHeartRadio? One of the things in a survey that they did, according to the list that they have on most beautiful lakes, Lake Winnebago for Wisconsin. So I thought that was kind of neat when that came across. And the other thing that I have, and Andy, you can put that up on screen. The, these can go around.
Sorry.
There's a wheelchair wash on Saturday, June 10th, sponsored by the ADRC, the Health Department, Care Patrol, and Covey. It's wheelchair wash for washing, inspection, and they've got entertainment, door prizes, and more. Again, Saturday, June 10th, 10 a.m. to 12 p.m. at J&R Auto Service at 629 North Main. And this is an annual event, and it's really great for folks that are using wheelchairs. They really need to have them inspected regularly. It's a huge safety issue. So I do encourage people to share that information. Do we have any other comments? Okay, Pat, you're going to be the speaker next month. You want to tell us?
Yes, I'll be speaking next month on gambling with the elderly and how it affects them, and what you can do about it.
So with that, I'll take a motion to adjourn.
Still moved?
Second.
All those in favor?
Aye.
Aye.
See you next month on June 6th.